The best experience I had in PMC Psychiatry is clinical supervision.
Living the philosophy of patient partnership.
The friendship, the camaraderie, and engagement of the staff and the residents.
The wit and humor of everyday work.
Meeting a lot of people from all walks of life.
The fun and challenges it brings us every day.
Working with the beautiful chair of the department, Dr. Mel Baton.
I learned a lot of things about life.
Seeing patients happy during OT time.
Having co-workers as friends.
Freely interacting with patients.
Working with amazing doctors and staff.
A holistic approach to medicine. Being part of a big family.
Patients, thank you.
Learning new cases.
This is second home.
Psychiatry unit was established in 1965 at the ABM Season Hospital, now known as the Medical City. The unit was established in response to the need of the community for a hospital-based treatment of individuals suffering from severe psychiatric disorders. It was then administratively under the Department of Medicine. The unit was located at the lower ground floor of the hospital to ensure patient safety. It had an open, spacious garden where patients had their sports and recreational activities. The unit was headed by top names in the field of psychiatry, with the aid of equally competent residents and graduates.
In 1998, an outpatient department was established to provide the residents with adequate training in handling outpatients and doing psychotherapy. The section of addiction psychiatry was gradually developed with the introduction of its programs: detoxification package for substance abusers, mentally ill and chemical abusers program, and the program for detoxified patients in October 2000. The section of consultation liaison psychiatry started its affiliation with the renal unit in 1999. The department also launched a support group for the relatives of chronic psychiatric patients called WeCare Support Group in June 2000.
The Psychiatry Residency Program had full accreditations in 1995, 1998, and in 2001. Since then, innovations in the training program were initiated to pave the way for better clinical and community learning experience.
Well, we've been very fortunate to have had residents in training who are all very eager to learn as the students. Very compassionate, we've seen that in actual practice. In 2004, the Department of Psychiatry transferred to the new hospital site of the Medical City along Ortigas Avenue, Pasig City. It is currently located at the lower ground floor. The department provides a wide range of services.
Consultation liaison utilizes a multidisciplinary team approach for assessment and treatment, with referrals accepted from all inpatient medical surgical units, which include cardiac rehabilitation, the cancer center, regenerative medicine, and the wellness center.
Being part of TMC Psychiatry is to me a special place of pride, and I feel good about it because I work with people that I like. TMC as an institution shares the values that I have always believed in and all psychiatrists who believe in. One is putting our patients on center stage, empowering our patients, establishing partnerships with our patients. So I take special pride and joy in having a son who chose to practice in the same discipline. And I'm very happy, especially because he's also connected with us here in TMC.
Since 2005, I'm the inpatient service chair. Recently, as a Joint Commission International or JCI accreditation champion, my challenge was and is to implement the world-class standards in our unit. Thus, we were accredited in 2007 and 2009.
greatest achievement for residency is actually each and every time that I have a patient who I treat and who actually gets better and goes back to his usual way of life. The most valuable lesson that I learned from residency was how to put myself in the shoes of the patient and really understand what they're going through. TMC Psychiatry is the best residency program in this country because we deal with a very holistic way of management for our patients. We get to use the latest and the best medications.
So what's new with the present management? So we have fellowship training in consultation liaison and addiction psychiatry. We are involved in the wellness of doctors and nurses in the entire hospital, and we have a more active community psychoeducation program. Our consultants at the department ensure that there is fun while learning for our trainees. And the medical city management creates a nurturing environment which encourages professional and personal growth for the medical, nursing, and support staff.
Competent and compassionate leaders.
High standards in mental health care for Filipinos.
Engagement in local and international community partnership for mental health care and implementation and promotion.
Professional and organizational goals that are aligned with the interests of those we serve.